Whether you have lingering symptoms after a COVID infection or you have a formal diagnosis, many people with long COVID start feeling better with time, but often we don't make a complete recovery. Why do many of us stop improving and plateau? Why does our recovery get stuck? And what can we do to jumpstart our progress? I have a few suggestions. I'm Dr. Zeest Khan. I'm a Stanford trained physician and I developed long COVID symptoms in 2020. I used everything I know about medicine and the healthcare system to get better. Now, on Long COVID MD, I explain the science, treatments, and strategies you need to improve your health. I've met many people with long COVID in all stages of illness, and I see this plateau happen quite often. Sometimes it's a matter of giving your current treatments more time, but sometimes it requires a change in approach. I've noticed 3 patterns when long COVID recovery gets stuck. I'll explain all 3 and the solutions I see to each one. Before we start listing reasons you're stuck, we've got to talk about the elephant in the room. The main reason you're still sick is because we don't have approved treatments, nor do we have a cure for long COVID. The science just isn't there yet. On top of that, we face ignorance in the medical community. Most doctors are not being malicious when they tell you they can't help you. They simply haven't been taught how. The healthcare system has been stretched so thin that there hasn't been enough investment in medical education to teach doctors about long COVID, how to diagnose, and how to treat. Because they don't know much about long COVID, they start believing it's a dead end, even when it's not. My point in saying all of this is, even though I'm going to talk about changes we can make as patients when our recovery stalls, it doesn't mean that your current approach has been wrong. I'm not calling these 3 mistakes because that's inaccurate and unfair. You can't make a mistake when nobody has offered an alternative. So keep that in mind as I propose 3 reasons your recovery is stuck. People with long COVID and other conditions that cause fatigue can fall into a push-crash cycle. Instead of pacing your energy and giving yourself regular time to rest and recover, you swing between going all out and collapsing, sometimes for days. What I see people forgetting is that even when you regain some of your energy, you have to be very careful to continue to work within your energy envelope. An energy envelope is your energy budget. You only have so much to spend before you pay the consequences. The best approach is using your budget slowly and consistently, because cashing out all at once has serious consequences. It's tempting to want to be strong and to push through, but you risk running yourself ragged and setting back your recovery. We know that in post-viral syndromes, including long COVID, dysregulated autonomic and immune responses can make our system less resilient to repeated stress. Research suggests that repeated exertion, whether that's cognitive, emotional, but especially physical, can be damaging. So ask yourself, are you pacing out your energy and taking regular rest? Or are you pushing really hard to get through the day, the week, and crashing after? The solution to this isn't always easy, especially because most of us have bills to pay and many of us have dependents. But rest isn't optional, and you'll benefit from carving out time for regular rest. The amount of rest you need depends on your functional limits and your symptoms, but the approach is the same. Ask yourself, where can I find ease? What can I take off my plate? How can I delegate? Where can I say no? How can I build rest and recovery into my daily life? It might be worth looking into disability benefits to take time off or accommodations to make work easier. And remember, you have workflows at home too that can be modified to reduce your energy expenditure. For a deeper dive and practical tips on how to do this, check out my interview with an occupational therapist who specializes in energy limitations. The fact is, you need time, and nothing can replace time. You need time for your physical recovery, but you also need time to reflect on your health, identify areas of need, and tend to your spirit, which is going through a lot. In addition to that, you need time for medical appointments and therapies. If you keep pushing and crashing, you may be setting back your recovery. And if you do it too intensely for too long, your body might force you to stop altogether. Ask me how I know.